Hi guys, it's Alyssa. I'm going to record for you my issue paper presentation on safe injection sites. So, you've all heard of the opioid epidemic. Many have tried to put a stop to this for years now. And one of the things that healthcare professionals have been doing is implementing harm reduction strategies, and the purpose of these is to treat addictions. But despite this, overdoses have continued to be rising, and the incidence of infection related to opioid use has also continued to be rising. And one controversial harm reduction strategy, which is in place in several countries, but not the United States as of yet, is called a safe injection site. So these sites are set up in regions where opioid use is very prominent, and the opioid using population can legally use pre-obtained drugs at these sites under medical supervision. So in the event of an overdose at one of these sites, healthcare professionals can give emergency care to the patients, and they can also provide them with treatment options and resources and with information regarding the dangers of continued use. So the issue of whether a nurse should work at one of these sites is very central to nursing practice at this time. Nurses need to decide if this is ethical and if this fits under the standards of the ANA. And they also need to make a decision regarding whether they're in support of policies which cause the sites to be legalized in the United States. Nurses also need to think about if the sites are more of a help or a hindrance in opioid addiction treatment. So I did some research on this, and the majority of the research that I reviewed focus on the positives of the sites, but we will start with the negatives. So if you're following along in the PowerPoint, I'll start with the not to have list followed by the to have list. So a few reasons that we should not have safe injection sites. There are a multitude of other legal harm reduction strategies, emphasis on legal, which can be used to prevent opioid misuse. Nurses can give free access to information on free access to naloxone, and nurse practitioners can also give users information on syringe exchange programs, which are in place. Another reason that safe injection sites would not be a good idea is that in public surveys, most of the participants in the United States say that public funds are better spent on addiction treatment. They do not want funds spent on these sites. Another interesting reason against these is that the sites operate under a very tricky legal setup. So each community differs in their rules for these sites, and this really does produce discord among citizens. And there is a huge lack of evidence for their effectiveness, and there's inconsistent evidence on their impact on crime and neighborhood overdose fatalities. So further studies really need to be done before policies are put in place. The site's purposes seem to breach what the nursing profession stands for. So the actions of a nurse at these sites seem more enabling in nature instead of preventative. That's another big reason nurses are against the sites at this time. So there are also, on the flip side, many reasons that we should have safe injection sites. First of all, the sites have been associated with safer injecting practices. There is a reduced reuse of syringes, and there's safe disposal of needles and syringes. And the sites really do have the ability to reduce infections, especially of HIV and hepatitis C, which are spread by obviously the sharing of needles. And this is because patients at the sites will receive a sterile needle and syringe with every injection that they attempt or go through. So that is a really big perk of the sites. Another perk is that users are in safe locations, so they are not rushing injections. Rushing injections is an issue because it's shown to increase the risk of overdose. So at the sites, there is a huge decrease in the overdose mortality rate. As far as public support goes, this may increase if surveys are reworded. So when the surveys went out to the US public, basically, everything was worded as safe injection site. But studies think that if surveys are reworded to use the title overdose prevention site, there will be an increase, possibly by up to 16% of the public, in favor of this different name. And this is because the title helps citizens to realize how many are experiencing unnecessary deaths in these places where the opioid use is so rampant. And so basically what this entails is that those with opioid addictions are very stigmatized by the public. And so that simple word change might make a big difference in support. Nurses can also say that sites have more than one goal. The goal of the sites isn't just to prevent overdose. These sites serve a multitude of capacities. One of these is to connect, obviously, with health and social services. Patients have reported like they are attending, and when they attend, they feel a sense of belonging because often they're really discriminated against in their communities. The sites also provide shelter and protection from violence for these opioid users, and one interesting thing I also found was that some sites have been set up on hospital grounds. So the purpose of this is that many who are receiving treatment in the hospital for their opioid addiction still want to be using at this time. They're not off of the opioid. And so if the site is on the hospital grounds, the patient can leave the hospital and go outside to the site, inject the opioids they need, and then go back for treatment. And this seems pretty backwards, but if the sites weren't there, the patients would just leave and they would go to the sites and not receive treatment at all. So that's a big funky perk. Nurses should also just not be negligent in their help to one aggregate of the public health spectrum. So as far as my recommendations regarding the resolution of this issue, I actually believe that legalization should be supported by nurses. And before I did this paper, I was on the exact other side of this issue. So I think that safe injection sites, based on my research, can really serve as a form of secondary prevention. And I think that they have the potential to halt the progression of and prevent dangerous complications of addiction. In my eyes, they're seen as a stepping stone to help those struggling with addiction to receive further treatment. And they're also, honestly, a form of primary prevention against infections of users and the public. So, yeah, I think that during policymaking, nurses should emphasize the various core missions of the sites. There's not just one mission. Nurses need to really make it evident that these sites are there to provide care, not encourage the use of opioids. So, yeah, and it's really been shown like these sites can lead to safety for those in a neighborhood where the use is really rampant. And those who are working to clean these places often struggle because there are many needle stick injuries that occur. And so, yeah, in those places where opioid use is notorious, these people are going to be safe trips to the hospital as well. So as nurses, we really do have a moral obligation to do right. And so I think that we should educate the public about addiction and just have mercy on all who are suffering, including those with addictions. We don't know their story, and we don't know when they started using, how they've tried to battle their addiction in the past, so we can't just assume those things. And with safe injection sites, we do have the possibility of saving many lives and giving many second chances, which I think is really cool. So this leads me into my biblical application. The most excellent example of one who grants second chances is Jesus. And Jesus is the ultimate picture of forgiveness and new beginnings. Both of these concepts really do encompass what leaders can offer followers. And so I think that nurse leaders should follow Jesus' example by taking it upon themselves to grasp just every opportunity in their power to heal. And in this, I'm really reminded of the story of the lost sheep. So by even preventing one more overdose, as a nurse, that shows to an opioid user that his or her life is incredibly valuable, both to the nurse and also to God. We are really called to care for the marginalized and the abandoned, and by implementing safe injection sites, I think that nurses will be able to show a picture of healing coupled with grace. So in conclusion, though having many pros and cons, safe injection sites should be vouched for by nurses in the United States. They will provide a means to prevent certain deaths, and they will aim to benefit the public in a wide variety of ways, not only one. In addition, they serve as both forms of primary and secondary prevention, which is very important. And with a change in public viewpoint, there really may come a change in policy. So even if safe injection sites are begun, nurses still really do need to emphasize the importance of utilizing multiple harm reduction strategies, not only the safe injection sites. But we should really display a Christ-like attitude of just yearning to love every life equally so that we will be able to save the lives of many people. So I hope you enjoyed this presentation and that you have a great day. Thanks for listening. Bye.